Hello, my name is Dr. Catherine Sylvester, and I am a physical therapist. For the first 10 years of my career, I worked in a hospital with people who had brain injuries, strokes, heart attacks, heart failure, and kidney disease. Many of these conditions were caused by uncontrolled and often undetected high blood pressure. After I had my children, I began working more closely with women and moms, and that's when I realized something important. Many moms don't monitor their blood pressure and don't realize that they may be at risk for serious complications that can be associated with high blood pressure. This became very personal for me during my second pregnancy. At one visit, I shared a blood pressure reading with my midwife that looked okay to most people, 128 over 78. But my midwife knew me. My normal blood pressure was much lower, around 100 over 60. And because of that, she immediately checked me for abnormal swelling, tested my urine for protein, and ordered labs to look at my kidney and liver function. She caught a problem early, and because of that, I had a safe delivery. That experience changed my life. Today, through my organization, Operation Mist, I help moms understand why blood pressure matters, how to monitor it at home, and when to reach out to their providers for help, which is what I want to talk with you about today. Blood pressure is the force of blood pushing through your blood vessels. These vessels carry oxygen and nutrients to your brain, your body, and when you're pregnant, to your baby. I like to think of blood pressure like a water hose. If the pressure is too high, the hose can burst. If the pressure is too low, water can't get to where it needs to go. But with the right amount of pressure, the hose stays intact and can do its job. A lot of people focus on high blood pressure, but low blood pressure is just as concerning. When blood pressure is too low, it can cause dizziness, fainting, weakness, difficulty concentrating, and reduced blood flow to vital organs. After delivery, low blood pressure can be a sign of heart failure, excessive blood loss, or severe infection. When blood pressure is too high for too long, it can cause severe headaches, vision changes, strokes, organ damage, and during pregnancy, it can lead to premature delivery, low birth weight, and can be a sign of a condition called preeclampsia. Preeclampsia is a condition characterized by high blood pressure, swelling, and an abnormally high amount of protein in the urine. If left undetected, it can lead to stroke, seizures, liver and kidney damage, blood vessel injury, coma, or even death. But when caught early, it can be managed. Some warning signs of preeclampsia, in addition to high blood pressure, include sudden swelling, especially in the face or hands, pain under the right rib cage, nausea or vomiting, and vision changes like blurry vision, seeing spots or floaters, or loss of vision altogether. If anything feels off, or if you notice any of the symptoms we just mentioned, call your provider immediately. You should also always call if your blood pressure is 140 over 90 or higher, and go to the emergency room right away if your blood pressure is 160 over 110 or higher. In monitoring moms, we've also learned that blood pressure doesn't always have to reach 140 over 90 for something to be wrong. So we also recommend reaching out to your OB, midwife, or provider's nurse if the top number of your blood pressure is 30 points higher than what is normal for you, if the bottom number is 20 points higher than what's normal for you, or if your blood pressure is lower than 90 over 60 and that is not normal for you. When in doubt, reach out. Providers would much rather hear from you early and help prevent a condition that is preventable than to hear from you when it's too late to help. When checking your blood pressure at home, use an automatic upper arm cuff, not a wrist cuff. Make sure the cuff fits your arm properly. Choose a monitor that has been validated for accuracy, and choose one that has large numbers that are easy to read. You also want to keep a log of your readings and check your blood pressure in the morning after using the bathroom, never on a full bladder, and then take it again at night before going to bed. Each time you check, take 2 readings, 1 minute apart. When you're taking your blood pressure, sit with your feet flat on the floor, not crossed, your back fully supported, your arm resting at heart level, and do not measure over clothing. You also should not talk or listen to others, and don't check your phone. Just try to focus on breathing and relaxation. It's also important to know that the risk of high blood pressure does not stop after delivery. In fact, blood pressure often rises 3 to 6 days after birth or within the first couple of weeks and can remain elevated for up to 6 weeks or longer if left untreated. If you had high blood pressure during pregnancy, delivered via cesarean section, or got a lot of fluids during your delivery, your risk is even higher. So please continue checking after you deliver your sweet baby. Doing so saved my life. 1 week after giving birth, my blood pressure spiked to 160/105, and I had no symptoms at all. Many moms believe they would feel something if their blood pressure were high. They also claim that their blood pressure monitor is not working because the reading seems unreliable. But high blood pressure is often called the silent killer for a reason. Sometimes checking your blood pressure is the only way to know something is off. Along with monitoring your blood pressure, there are things that you can do to help keep it in a healthy range. These things include drinking plenty of water, eating fewer fast, frozen, and packaged foods, moving your body in ways that feel safe and supported, and reaching out to a physical therapist or occupational therapist if you need guidance with movement, prioritizing 7 to 9 hours of sleep at night when possible, reducing unnecessary stress, and saying yes to any and all help that is offered during your first 2 weeks after delivering your baby. Thank you for taking the time to monitor your blood pressure and for committing to reaching out to your provider if something feels off. Because you matter, your life matters, and catching problems early can save lives, just like it did for me. If you need any support or have any questions, please reach out to Healthy Mothers, Healthy Babies Coalition of Georgia or visit their website at picklesandicecreamga.org. You deserve to be supported, and we want to provide you with all the support that you deserve.